From a global perspective, adolescents, persons typically between the ages of 13 and 19, represent a significant demographic and socio-economic force. In Belize, the estimated population of adolescents is 88,000, making this group capable of influencing trends in various areas such as health and education. For the past year, officials from the ministries of health, education, and human development have been working on the Adolescent Health Strategic Plan with the aim to offer adolescents an affordable and a more structured package that would influence their growth and development.
The mission is for us to work with strong partnership, like wraparound services for adolescents, providing the protection that they need to grow and develop and reach their full potential. The plan is focusing on ensuring that adolescents have their identity documented, like having a social security card that will help us to track the services that we provide to them. We are aiming at improving the access to education. We are looking towards improving the quality of the health services, expansion of coverage, working from the community, with the community in all aspects.
Considered a special stage in any person's life, adolescents represent a period of transformation from childhood into adulthood. It is during this period that young people go through significant changes in areas such as biology and behavioral. If these changes are not properly managed, it can lead to risky behaviors with immediate and long-term consequences.
We're trying to understand that there are many dimensions that affect and that they are part of their development. So we are trying to approach very centered on the individual as a comprehensive development, which means that we must include all sectors that are involved as part of the development of the strategic plan. The biggest preoccupation I would feel that is in the discussion is maybe violence and for the adolescents have been involved lately, which is a problem that the government is very sensible to tackle very quick. Also sexual and reproductive rights as well, I guess healthy lifestyles as well. But we have also been tackling other issues related to access to education, participation, environments where adolescents have access to creative expressions and how they use music, how they use arts, just to express themselves and to be an active part of society.
The Adolescent Health Strategic Plan is designed for the next 5 years, but will be extended to 2030 in order to meet the Sustainable Development Goals and the Children Agenda. Over the past year, officials held consultations with youth in all districts in order to get their views.
Right now, what we're looking at the first 5 years is more related to inputs and looking at the competencies that the different category of staff requires to provide better quality services, looking at standards and norms that needs to be in all the different areas where the adolescent will have contact with providers. And basically, those would be one of the main areas that we will be focusing on these first 5 years. And then later on, we will cover the other areas that we are proposing in the plan.
The initiative is being funded by the government of Belize and UNICEF. Hipolito, Novelo, News 5.